ಅಲ್ಲಿ ಹೋಗಿ ಅಲ್ಲಿಗೆ ಬಂದ್ಬಿಡ್ತು ಅಷ್ಟೇ. ಇದನ್ನು ನೀವು ಓಪನ್ ಮಾಡಿ ಇಟ್ಕೊಂಡಿದ್ದೀವಿ. ಓಕೆ,
ಅದು ಟೈಲ್ ಚೇಂಜ್ ಮಾಡಿ ಅಷ್ಟೇ.
ಯಾವ್ದು ಮಾಡಿದ್ವಿ ಆಮೇಲೆ ಮಾಡ್ಕೊಳ ಆಟೋ ಕೊಟ್ಬಿಡೋಣ ಸದ್ಯಕ್ಕೆ, ನೋಡೋಣ ಆಮೇಲೆ ಸ್ಲೈಡ್ ಬಾರ್ ಅದಾದಮೇಲೆ ಬಂದು ಒಂದು ಸಲ ಅವ್ರು ಮಾಡಿ. ಓಕೆನಾ? ಇದೆಲ್ಲ ಏನು ಬೇಡ ಅಲ್ವಾ, ಡೆಸ್ಕ್ಟಾಪ್ ಒಂದು ಇರಬೇಕಷ್ಟೇ. ಆಡಿಯೋ ಆಫ್ ಮಾಡ್ಬೇಕು ಅನಿಸುತ್ತೆ.
ನೋಡಿ
Check. Check. Check.
ದೋಸ್ತ ವಿಡಿಯೋ ಆನ್ ಆಯ್ತು ನಂದು.
Good afternoon to all of you. In another few minutes, we'll be starting the webinar organized by KSCST. Please mute yourself. All of you are requested to mute yourself. In another 3-4 minutes, in another 3-4 minutes, exactly 2:35, we'll be starting the webinar. After joining of our dignitaries who are part of our webinar, please bear with us. Another 3 minutes, we'll be starting the program. Good morning.
ಸ್ಟಾರ್ಟ್ ಮಾಡೋದು ಅಷ್ಟೇ.
ಕೆಲಸ ಮುಗಿಸ್ತಾರೆ ಕೇಳ್ಬೋದು ಸರ್. ಪ್ರೊಫೆಸರ್ ಅಶೋಕ್ ರಾಜ್ ಸರ್, can you start, sir?
Yeah, let's start.
Yeah, thank you, sir. Okay, over to Mrs. Ranjini.
Good afternoon, one and all. On behalf of Karnataka State Council for Science and Technology, I, Anjani, Project Engineer, welcoming you all for the second webinar on application of nanotechnology and materials engineering. Since KSCST is celebrating its Golden Jubilee, on this occasion, we are organizing a year-long webinar as well as other activities for the overall development of the state. The aim of this webinar is to give information about opportunities and applications of nanotechnology and materials engineering. The eminent scientists from Indian Institute of Science, Bengaluru, and Indian Institute of Technology, Bombay, sharing their insights and experience in this field. I'd like to welcome Dr. U.T. Vijay, Executive Secretary, KSCST, to brief about this program. Over to you, sir.
Thank you, Anjani. Namaste. Good afternoon to all of you. Respected dignitaries and experts who are part of this second Golden Jubilee webinar of KSCST. Professor Navakant Bhatt, Dean, University of Science. Professor Ashok M. Rachur, Professor, Department of Materials Engineering, University of Science, and Secretary, KSCST. Professor Rohit Srivastava, Professor, Department of Biosciences, Indian Institute of Technology, Bombay, Mumbai. My dear colleagues from KSCST, colleagues from different district NRDMS centers across the state, respected Vice Chancellors, Principals, faculty members, and different officials officers, scientists, and member secretaries of various state councils across the country, and my dear students who have joined online across the state as well as across the country. I take this opportunity to welcome all of you to this second Golden Jubilee webinar being organized by KSCST to commemorate the golden year of existence of KSCST. First of all, I would like to wholeheartedly welcome Professor Navakant Bhatt, Dean IISc Bangalore, to this webinar to inaugurate this session and deliver the welcome address. And I also welcome Professor Ashok M. Rachur, Professor of Department of Materials Engineering and Secretary of KSST to this webinar. I also welcome Professor Rohit Srivatsava, Professor and expert in Nanotechnology, Department of Biosciences and Biotechnology, Bioengineering, IIT Bombay. I also welcome all the VCs, principals, faculty members of various universities, degree colleges, engineering colleges across the state and across the country. I also welcome the officials of scientists of various SNT councils across the country. And also I welcome all scientific officials who have joined from various R&D and SNT organizations across the state as well as across the country also. And I also welcome dear students from engineering as well as science stream from across the state as well as across the country who have joined online to be part of this celebration of Golden Jubilee webinar being organized by KSCST. Next slide. As all of you know that KSCST is one of the first state science and technology council to be established in 1975 by the vision of then Director of University of Science and Professors of IISc to take the R&D and innovations takes place from lab to land in order to improve the infrastructure and natural resources of the state by using science, technology, and innovations. And also, Honorable CM of Government of Karnataka is the president of our council, which is having the members of 45 members representing government officials, government officers, some ministers, and scientists across the state and country also. The main objective of council is to advise the government or line departments using science and technology to address the local specific problems being faced by the state and extend the assistance in promotion of quality of science and engineering education to produce quality human resources across the state from various academic institutions. Address the local specific problems using science and technology, especially in the area of water, energy, environment, agriculture, education, health, housing, geo-ICT, geographic information system, and information communication technology, intellectual property rights, etc., for sustainable development of the state. For outstanding performance in the area of using science and technology and innovations to address the problems of the state, KSCST so far has received 3 national awards for outstanding performance in the area of energy conservation, geospatial technology, and intellectual property rights. Next slide. As I informed you earlier, Council has been working on various sectors, especially under the area of water conservation, energy, promoting renewable energy sources, environment management, and environment conservation, education to improve the education of engineering as well as science across the state, health, geo-ICT, agriculture, housing, intellectual property, and science and technology population and outreach programs in order to inculcate scientific temperament across the state among the students and young generation of our state. As part of water sector, in addressing the water quality and water quantity, KSCST has utilized the nanotechnology, which was developed by IIT Madras to address the water quality That too, to address the arsenic contaminants in drinking water facility of 2 districts. These are the nanotechnology based water purifiers which were developed by IIT Madras, starting from 20 liters per day to almost to addressing the multi-village water supply scheme, 1 lakh liters per day capacity, wherein nanometers are being used as a water purification media in this water purification unit. Next slide. Using this technology, which was developed by Professor Pradeep from IIT Madras, KSCST tried to install 2,000 liters capacity to address the arsenic affected area in one of the village in Yadgiri district, one of the aspiration district, to address the arsenic problem. And as part of our monitoring, we could find 0.35 ppm was the input water arsenic contamination. Then after passing through the water purification using your nanomaterials, nanotechnology, the output water arsenic is 0.01 ppm, which is desirable unit as per BIS as well as the WHO standards. Next slide. Similarly, bigger capacity, just 5,000 liters capacity was established in Medinapur Gram Panchayat in Lingsugur Taluk of Raichur district, where we could find input source of 0.073 ppm. Still, it is a larger, more than the desirable unit. So using this nanotechnology based water purification, we could get arsenic just below 0.01, which is a permissible limit as per the BIS and WHO standards. People have been using this water for consumption, for drinking water, and also they are not facing any health-related issue which were there prevalent before the installation of these 2 units in Karnataka. That is how we have been using this nanotechnology for various sectors. Anyway, it will be addressed by our experts in near future. So with this background, I once again welcome Professor Navakant Bhatt, Dean in Of Science, also the chairman of Vision Group on Nanotechnology, Government of Karnataka, and was the professor and former chairman of Sense University of Science, to inaugurate and deliver inaugural address. I once again request and I welcome you, sir. Over to you, sir, Professor Navakant Bhatt.
Yeah, thank you, Dr. Vijay. I appreciate your introduction. I'm very delighted to be part of this kickoff meeting on 2 exceptionally, renowned people who will, tell you about applications of nanotechnology in medicine and healthcare, and of course, nanomaterials and nanotechnology, right? And also, I'm glad to have both Professor Raichur, who is of course Secretary of KSCST, and Professor Rohit Srivastava from IIT Bombay, whom I have known for many years. I'm very glad that they are participating this, and welcome you for this KSCST event. It may sound odd, Professor Raichur, you are the KSCST Secretary, and I'm saying this, but nonetheless, you are making your time available to give this technical talk, and I really appreciate that. As Dr. Vijay mentioned, Karnataka State has been at the forefront in, taking many steps in nurturing science and technology in the state, and which will have a cascading effect to benefit rest of the country as well. For example, there's already, Karnataka State is one of the first state to have a, policy on IT way back many years. Then that led eventually now to BT and NT, which is biotechnology and nanotechnology as well. And very recently, the state is also taking many steps in the emerging quantum technology domain as well. So in all these respects, I think, it is indeed very heartening to see the initiatives from the state of Karnataka and the government of Karnataka. And of course, KSCST being one of the very important science and technology departments of the government, they are spearheading many programs in this domain. And in particular, nanotechnology has applications in almost all domains of modern science and technology. You can call it a meta technology, which means that, it will have applications in every domain of human endeavor. Because it's essentially the science, art, and technology of making things miniature, very, very small, sukshma, ati sukshma, and then harvest the devices and various materials that we make using the understanding of the science that we discover at nanoscale. So, medicine and healthcare is one of the focus area as a country. And it's very unfortunate that today, if you look at the healthcare ecosystem in India, we still continue to import up to 80% of medical technology, be it pharmaceuticals, be it medical devices, and any part of the medical healthcare system. So I think it's very important that our homegrown science and technology, is supported. Of course, there is a lot of advanced research happening across many institutes, IISc, IITs, but that is not good enough. We really have to translate that. And in fact, today you will see many such examples of translation in both the talks. So the students, I'm very glad there are more than 100 students. I think I see 137 attendees right now. I'm very glad that there are so many students participating. I hope that you will learn from these two experts in the next 2 hours and have an opportunity to interact with the experts and make the best use of this opportunity. I think we really want you to not just listen to these lectures, but also perhaps consider making your career option in the area of nanotechnology, nanomaterials, and in particular for healthcare and medicine application. So with that, I will stop here, and I'm looking forward to. I will have to leave due to other engagements, but I'm looking forward to have this two expert talks in this session. Over to you, Dr. Vijay.
Yes, sir. Thank you for your inspirational welcome address. Thank you very much. But your expertise and your expert in the field of nanotechnology, definitely it is taking a lot of initiatives in the state of Karnataka, and as a chairman of Vision Group for Science and Nanoscience and Technology in Karnataka, definitely is taking a lot of initiatives. Thank you very much. Now, I request Professor Ashok M. Rachur, Professor of Department of Materials Engineering, IISc, and Secretary KSCST to address the gathering using his experience, application of nanotechnology in the area of health, especially medicines. So go to Professor Ashok Rachur, sir.
So shall I start my talk now, right?
You can start, sir.
Okay, fine. Let me share.
Sir, Professor Ashok, Rohit Srivastava joined, sir. Please, you are second. Welcome, him, sir.
Rohit, welcome.
Yeah, I'm there. Thank you very much.
Yeah.
Yeah, Navkant is also there. Navkant is there.
Yeah, yes, sir. He's there, sir.
No, just give me a second. I think this I have not done using.
There's an arrow pointing up at the bottom, right?
No. This one, I did something to my browser, so I think it's asking me to redo the sharing and other things. Just give me a minute. I'll log out and log in.
Okay, sir. But please, carry on, sir.
So, Professor Rohit, did you want to say anything? Of course, you will have a detailed talk later, but the audience are there. Okay, I think, right?
Yeah, yes, sir, Professor Rohit, please. Because the Navkant, but we'll leave for another engagement shortly.
Yeah, so no,
Yes,
I just
thanks for
wanted to
asking.
thank. No, let me first thank Professor Navakant and Professor Raichur for asking me to come and give a talk here. Most importantly, I've been following the work that Professor Navakant has been doing over several years, and this is where I take my inspiration. You'll see in my talk as well. But I think what Professor Navakant mentioned about India still importing so many of these medical devices, nearly 80% or nearly 90,000 crores worth. I think this is something that students need to take note of. If each one of us can make just one product and do it through our state science councils, through our government organizations, I think we'll create a big enough impact that very soon we'll not be dependent on imports. So I'll show students some work that is happening in our lab, many of it which is translational, many startups and many technologies that will that have either reached the market or will reach the market in a few years' time. But I hope that this will now be the starting of many more students doing what Professor Navakant Bhatt has been doing for so long. So thank you very much.
Thank you, Professor Rohit. We are all eagerly waiting for your talk in the area of application of nanotechnology in the healthcare systems. Thank you. Now over to Professor Ashok Raju. I think he has left and he will be joining, rejoin and share his presentation shortly.
Yeah, I think he's there.
Sir, yeah, continue.
Sir, you are mute, sir. Just you open the mute, sir.
Okay, let me try now. So there's some problem. Now I can see it. Finally.
Yes, sir. Yeah.
Okay. But I can't see my presentation, that's the whole.
Sir, there is an arrow mark.
There is up arrow, sir.
Up arrow, sir. Adu, sir.
Left.
Really hand signal pakka irodu.
I am facing some problem here. Just give me a second. During sharing, I can't see my PowerPoint, How do I do
No, you share your whole screen. And then you come at the bottom, then the PowerPoint application will show up there. You get the cursor all the way down. First you share the whole screen. Now, yeah. It's fine. Yeah.
Yes, sir. It has come, sir. Thank you.
Yeah.
Fine. So shall I start then?
Yeah, you can start, sir.
Okay.
It's visible.
Yeah. Okay. Good afternoon, everyone. I am a part of KSCST. So we are organizing the Golden Jubilee celebration this year. And when we thought about the series, this one topic was nanomaterials. So I raised my hand. I said I'll also share some of my work. And good afternoon, Professor Navakant Bhatt. Thank you for coming and inaugurating this today's lecture series. And also Professor Rohit Srivastava for joining in since we contacted him last week. So with that brief introduction, I'll quickly start now. So my area of expertise is being a metallurgist, but I work on nanomaterials and especially in medicine. And I will share some of my thoughts and as well as my experience and some results that we do in our lab. So with that brief introduction, these are the areas of research in my lab. Currently, we have been working in recent past on 3D bioprinting. A lot of work we have done over the past 22, 23 years on nanomedicine, especially related to cancer and infectious diseases, treating them. Then we have also developed light responsive organic and inorganic biomaterials in the recent past. And we have been working on nanotoxicology for quite some time in collaboration with one of my former students. So when we talk about medicine, I will keep it a little general, the talk, so that the audience, they can follow me as we go along. We are used to these diseases, right? We hear them around. Some of us would have suffered some of these things, particularly infectious diseases like bacterial and viral infections. Then cancer is one of the major diseases in the world, which is still, although treatments are available, but then it causes a lot of side effects. Then bone-related diseases, oral hygiene, then eye-related diseases. Then we have neurological problems, several of them. And finally, we have some man-made problems, like accidents, burns, etc., primarily to the bone and skin. So there are a number of them which have already treatments available. But for some of them, it is possible that can we reduce the side effects or can we make the treatment more effective? These two things are always, people are trying to find solutions for this. And that is where nanomaterials have found the edge. So people have been working with nanomaterials for about 40, 50 years now. Especially in the last 30 years, it has seen a lot of progress. And I would like to share some of my thoughts on that. So these are the medicines that we take. Many of you know these medicines. They work very well. So mostly all of them are taken by the oral route for a systemic treatment. So we have tablets of various kinds, various colors. Then we take suspensions, liquid form. Then for nasal treatment, we have sprays. And for the treatment, or when we have some injuries and things like that, we use some ointments or creams. Then we have eye drops. And then many of us take injections for various things, and there are different types of injections that are available depending on the application, intramuscular, subcutaneous, intravenous, and intradermal. Now, many of them work well, but there are some disadvantages which people claim. And for example, if I'm doing a systemic treatment using these tablets here, you can see that we may need to take tablets a lot more. There may be loss of the active drug molecule through the body because it gets excreted. And so we need to take more of it. So similarly with other medicines also, for example, if you take the one that we put in the eyes, for example, most of it tears up. Your eyes tear up immediately as soon as you put the medicine, and a lot of the drug is lost in that. A little bit gets inside. So we need to take these medicines time and again. And we are trying to improve that so that with the least amount of medicine, you have the maximum effect. So how would you go about doing that? So if you look at this graph, this shows the drug concentration in the plasma, that is in the blood, versus time, right? So as soon as you take a medicine, if this is 0.0 here at the beginning, and as soon as you take an injection, or let's say you swallow a tablet, then the drug concentration in the blood goes up. For an injection, it goes up very fast. For a tablet, for example, it takes a little while, but eventually it goes up. So you reach a peak like this, and then after some time it drops quickly. You see that. So then at that point, you need to take one more shot or one more tablet, and then you keep the concentration high. So you need to maintain concentration in this window here, which is called as the therapeutic window. Right? There is a maximum effective concentration and there is a minimum effective concentration. So if you are below this, then the drug will not have any effect. If you are above that, then you start having some side effects. So both are bad actually. So you need to maintain the drug concentration somehow in this profile. And for that, an ideal one would be a zero order control release, where you inject or take the drug and then it stays constant throughout, let's say for a certain period of time. But this is not possible to achieve. So normally we end up having something called this, what is called as the sustained release. This red graph here. So it goes up, stays in the window for a long amount of time or a larger amount of time, and then eventually it drops slowly. So if you can do that, then what happens? If you can see now here, for a single dose, you are able to cover the same range as 2 doses in this case. So you are able to reduce the number of dosages, and you can increase the efficacy also. So in my lab, we study 2 diseases, cancer and bacterial infections. So I'll give some examples of that as we go along. Cancer, as you know, there are several treatments that are available currently, all well-defined strategies, but then they have a lot of side effects. You can see here, I don't have to name them, but I think many of you would have heard about them, particularly anemia, hair loss, diarrhea, and, especially when you do, let's say, radiation therapy, people start developing a lot of boils and things like that. So there are a lot of infection. These side effects are sometimes more dangerous than the cancer itself. Why does this happen? One of the problems with drugs is the drugs, chemotherapy as we use, let me just go back here. So chemotherapy is the one where the drugs are used, right? Medicines are used, and this is called as chemotherapy. In chemotherapy, normally it should work like this, on the left side. This is shown as one cell, but actually there are two types here. The left side is the drug sensitive one, and the right side is the drug resistant one. So typically your drug will enter inside here, and then it creates ROS, or it enters the DNA here, and then it damages the DNA and the mitochondria, leading to apoptosis. The cell death takes place. But in a drug resistant cell line, this drug comes in, and is effluxed out. It is pumped out after some time, and it doesn't do its required function. So your DNA and the mitochondria remain intact. So these are called as drug resistant cell lines, and they seem to be prevalent in many different kinds of cancers. Similarly, tumors that are formed, the tumors form in one part of the body, and eventually through various mechanisms they get into the bloodstream, and then they go to another part of the body. So in a common layman's language, we call it the cancer is progressing or spreading, and then eventually you start seeing cancer all over the body. So this is a secondary site, this is the primary site, and this is the secondary site here. So this is called as metastasis. So how do we prevent this? Normally tumors are taken away by surgery with a small amount of chemotherapy that is done. But while doing surgery itself, there are chances that some of the cells will get dislodged, and they may travel to other parts of the body. That's why a very strict monitoring mechanism is there to rule out cancer. So that is the part about cancer. There are some challenges there. Now we'll talk about the bacterial infection part. So this is called as the Peyer's patch, or the part of the intestinal, small intestine, to where the salmonella, for example, which is a bacteria that causes typhoid, it gets into the system. So this is how it gets in. It is taken up, it forms vacuoles, and then eventually it is thrown out. And it can go to either to the other parts of the body or the lymph nodes, or it can get into a vacuole like this. So bacteria that are free, they can easily be treated. So when you take antibiotics, for example, these cells will get killed, or they get eliminated. Whereas the ones sitting in the vacuole, they are not easily targeted because they are protected. So given the right environment or the situation, these can start opening up again, and they start multiplying, and the infection comes back. So how do we target the salmonella that is sitting inside a vacuole was one of the challenges that we took up. So the motivation is, can we use nanotechnology and nanomaterials to address some challenges in treating cancer and infectious diseases? So we all know about the size part, nanomaterials, how small are the molecules. So if you look at the human hair, which we normally think is quite small, and this is what it is, a protein or a virus, this is about 100 nanometers, 10 to 100 nanometer range, whereas this is about 100,000 nanometers. So you can see now, these are the particles. So you need to make particles which are of this size, somewhere in this range, let's say 200 to 300 nanometer size. And this table I have presented here to show the effect of reduction in size. So for example, if you have a sphere which is 1 meter in diameter, right? So you have the percentage of atoms on the surface is something about this number, right? And then as you reduce the size, you come down to 1 nanometer diameter, you can see now the percentage of atoms that are on the surface has gone up significantly to 60%. Here it was about 10 power minus 8, which is a very insignificant number. So what this tells us is that as you reduce the size, let's say here from 1 meter to 1 nanometer, you are exposing the atoms to be so that the surface becomes more active. So because of this active surface, and because of the number of atoms that are present on the surface, we call it's a very active material. So it can be used in number of applications, including energy. We could use it as a catalyst. We could use it for delivering drugs, for bypassing some of the mechanisms. and then several other applications, and diagnostics also. So with this brief introduction about the particles, so I will tell you now what kind of particles are available or people have used or developed in the past. So this is a general classification. We have three types of particle systems: polymeric, inorganic, and then lipid based. So polymeric ones, without going into too much details, maybe some of you may not quickly understand this at this point of time. I'll just tell you that we have the capability now to make different types of structures, right? People around the world have worked on this. These things are available in the literature. One can synthesize this. So this is like a self-assembling polymersome, which is exactly similar like a liposome. And we have dendrimers, and then we have nanospheres on which the drug molecule can be attached. So here we can play around with the particle size. It's very easy to design them, and easy surface modification, right? But there is a possibility of aggregation and toxicity or even accumulation inside the body if it doesn't degrade. The advantage of polymeric material is that we can make it into such a system that it degrades, through some mechanism by the time it exits the body. Inorganic systems, in contrary to polymeric, they cannot be degraded. So, for example, mesoporous silica particles, quantum dots, iron oxide, gold, several other particles are available. We could use them. This is very easy to monitor, to tune the size, structure, and geometry of these particles. The chemistry is well known, well suited for theranostic applications. That means we can use them for detection of diseases or understanding where the disease is and how it is behaving and things like that through various mechanisms. Toxicity and solubility limitations are always there. The lipid based are probably the best ones, making use of fatty acids that are already present in the body. These are called as liposomes. So we use lipids and assemble them using various chemistries. So we have lipid nanoparticles. We have there is also something called a solid lipid nanoparticle. We have liposomes like this. In the core is where the drug can be encapsulated. And we can have an emulsion like this, and oil water emulsion and things like that. Here, the high bioavailability is a good option. That means when you take a X amount of particles, load them with some amount of drug, and you send it inside or you inject it inside, the amount of drug that is available locally will be very high. And that term we call as bioavailability. And then we have the payloads can be tailor-made, but of course the problem is low encapsulation efficiency. However, we need to compromise on some of these. That is encapsulation efficiency, the loading efficiency, the release part. So we need to tune these parameters for each of the systems that we are developing or preparing. Nevertheless, for when the COVID came in, we all took, the shots, right, for our COVID vaccine, and that was made up of a liposome, into which the mRNA was loaded. So these technologies are well developed. Just to summarize this part, so we have nanoparticles which can be tuned. We don't go to 1 nanometer size as such for these kind of applications. Typically 100 to 200 nanometers is where we focus on. As I said, several materials could be used, several shapes can be prepared, and the surface can be modified using different chemistries. For example, one can play around with the surface charge, whether it could be positive, negative, or neutral. We can add a targeting ligand to it, like an antibody, peptide, or aptamer, so that it goes to a specific site that I want to. For example, I'm targeting a tumor, and I know the functional groups that are already expressed there or overexpressed. Then I can use a ligand on the particle, which can then go and target that particular site. I can also modify the functional groups, and then I can also do something called polyethylene glycol. This is a polymer, so we call it pegylation, this process. So if I add these PEG molecules onto the surface of this particle, then we can prevent the absorption of other molecules onto the surface and enhance the circulation time of the particles in the blood. So there are several strategies that are available. This is a very widely studied field, very hot field, I would say. And many people are trying to translate their work into, let's say, some products. This is the same thing, the strategies that are there, I just mentioned, that we play around with the surface properties, then we can add receptors, antibodies, and things like that. We can play with the size and shape. Most importantly, we can how do we trigger the release of this? One is to encapsulate the drug, the other is to release it at a certain site or at a certain time, in a certain way, let's say the rate of release itself. So for that, we need some triggering mechanism. So the endogenous triggers that are there inside the body could be acidic environment or a hypoxic environment, the enzyme levels that are expressed at a particular site, and then the metabolic shifts. The exogenous trigger, that means from outside the body, I could use light, sound, or a force. For example, ultrasound is a very good way, or even a magnetic field could be used. So that's the strategies that we use to release it. This is a kind of a summary of the same thing. I think I'll skip this slide. It is sufficient to say here that when we have a cell like this, and we could use all the strategies that I just described. So we could use it for diagnostics, we could use it for delivering therapeutics, and also we could use them for targeting. So there are various combinations that one needs to look at, and how after entering the cell, how does it do the damage, without going through the endosomal escape. So there is something called endosomal escape that happens inside a cell. So your molecules can be lost through that. So we need to avoid this route such that it finally attacks the mitochondria and the DNA. Okay, so let me go back to if I want to target different organs, for example. So we have brain, lung, liver, lymph nodes, and the bone. And the particle size that are needed are quite different for each one of these. For example, the brain needs very small sizes, something of the order of 5 to 10 nanometers, although it says 100 here, but it's much less than that. Then we have lungs. If you want to target a lung, it should be greater than 200 nanometers. For a liver, it will be less than 100 nanometers. And if it is greater than 100 nanometers, the particles will be taken up by the Kupffer cells. And lymph nodes, something of the order of 25 to 30 nanometers. Now, this is where the interesting thing happens. If you make particles that are too small and inject them, then they can be removed quite easily through the liver. So without doing their job. So that's why we need to play around with the particle size to figure out which part of the body they are going and how do we accumulate them at a particular site. And as I already mentioned, different building blocks are available: polymers, lipids, metals, carbon, biologicals, and we can make them into different shapes, and sizes as we want them. Right? So biological barriers to precision medicine. So this inner ring, so for example, let's say there is a human body, and then the biological barriers that nanoparticles can overcome. So nanoparticles can easily flow inside the blood, that I already told you. There is no problem with that. And as long as they are not covered by the protein and don't lose their surface properties, they can, through the blood vessel, they can enter to a tumor, for example, either through targeting mechanism, or we call it active and passive targeting. So they can somehow reach the tumor part. That is possible. They can go inside the cell, a mammalian cell, and then they can target and kill and they can destroy the DNA and the mitochondria. They can also cross epithelial barriers, because just like I'm going to show now, that we'll use this for our, let's say, antibacterial treatments. So crossing epithelial barriers is quite possible with the nanoparticles because of the size. There are various mechanisms for this. I'll just show you some of them in the next slide. But then, what precision medicine application that benefit? So we could modulate the immune system and response. We could create autologous cell therapies, then characterizing specific barriers to reaching tissues, stratifying patient based on biomarkers and genetic information, and then we can also determining pharmacokinetics altered by the disease state. So we also call this sometimes as precision medicine, because we can tailor make it in such a way that it can be used in a particular patient, so that it goes and does a particular job, without causing a lot of side effects. So that's why we call it precision medicine. So there are two types of, or three types. So one is a systemic treatment that we all take, that it goes through the body. Either we take it through an oral route or through the IV route. Then we have triggered release. So where the drug, this is a free form. So when the drugs are given in this thing, we call it as a free form. And triggered release is what happens when drug is released in one region or area of the body through a specific trigger. And then we have local treatments where we can deliver the drug highly at a local site. For example, if you are treating a knee injury or for example, a knee that has been having some problems, so you can use a local injection itself. So all these systems are available with us. The other part you have to understand in our in this kind of area is passive targeting and active targeting. Passive means the system happens. Basically, it's a natural process. So you inject the drug or the particles inside, and they will use the normal mechanisms to reach the site. So the probability of your particles reaching a particular cell or a site may be a little less. So we need to be careful with this. Whereas in the active targeting, we can functionalize the particle. So make sure that majority of it reaches a particular site. For example, in this case, it can be a tumor. So let's say I've just shown an example here. So for example, if you have a tumor here, so active targeted goes in, and not targeted, they can be distributed all over the body. You see that these are the particles that have gone all over the body. So this is the difference between active and passive targeting. So normally many people try to use the active targeting. The other part is depending on the size, the shape and the charge and what coating you have on the particle, they can be taken up in different ways. For example, here we have, if you look at these particles, if you look at the particles here, we have coated particles, you have charged particles, you have neutral particles, right? There is no charge on this. And so you can see that the coated ones and the negative charge ones are going easily into the system, whereas the other ones get macrophaged, they can be taken out of the system. Similarly, the rod-shaped ones seem to get inside break the epithelial barrier and get inside quite easily as compared to the spherical ones. Then if you are functionalizing it, in this case, let's say if you are a targeted one, so they seem to be taken up quite easily as compared to the charged ones, right, or the neutral ones. And when you're talking about the mucus, that is, I just showed you the Payer's patch. So there, the charged ones seem to be active to be taken up more easily, and the neutral ones, as well as smaller sizes, are passing through it more easily as compared to the larger size particles. So all the things come into play now: the size, the surface properties, whether it is charged, not charged, positive, negatively charged, and then whether it is coated or not coated. So these are some of this is a summary that has been made by some of our colleagues in Virginia. And I normally show this just to show you the advent of nanoparticles, how they have progressed over the years and where we stand now. So you can see that microneedles, right? The pegylated polymer nanoparticles, targeted pegylated liposomes, the metal organic framework, which we also work in our labs. So these are some of the things that have come of age in the recent past. In the previous one, in maybe 20, 30 years ago, we had dendrimers, polymeric particles, and other things that came up. So one of the most active groups in the world, Professor Langer's group at MIT, has developed a n number of the particle systems and have commercialized it also. And they also are the ones who made the vaccine, which is marketed by a company called Moderna. These are some of the FDA approved ones. So there are two things that happen now. One is we work in the lab, we develop the systems, and we do maximum up to animal model studies. Once we are convinced with the animal model studies, then we go to clinical trials. In clinical trials itself, there are 3 phases. And then if everything goes well and we present the case to the Food and Drug Administration, which is the authority which approves this in the US. So then when they approve it, then it goes into the market, production and then marketing. So these are some of the things that have been approved by FDA. And you can see that the lipid nucleic acid nanoparticles, the pegylated ones, which is marketed under Adagen. Then we have polymeric particles, viral vectors. So these are currently being sold in the have been approved, and they are currently available in the market. Now I'll come to some of the basics. When we load the drug, how do we load the drug and how it comes out? So we have surface loading systems, matrix loading, and then cavity. So surface means it is right on the surface of the particle. Matrix means it is inside the particle itself, but there is a monolithic structure there. And then we have cavity where there is a hollow cavity inside into which the drug can be loaded. So if you look at all these three systems, these two seem to be more preferable in terms of the amount of drug that can be loaded. Whereas this one, the amount of drug that is loaded on the surface can be very small enough. So you can do by direct absorption, linker mediated loading or coating mediated loading. There are three ways to do it. But among these three, this has the least loading capacity. But it's easier to make these things. Then the matrix loading ones, you have to precipitate the polymer. These are primarily polymer-based systems or liposomes or micelles. And the drug gets encapsulated. But then for this drug to be released from the interior, the whole, the matrix has to degrade. So as the matrix degrades from the surface to the core, then these particles will be releasing. So it is the rate controlling step is the degradation of the polymer. So one needs to tailor that depending on the application. Now then comes, of course, if you want to have a slow release system, then this is the most ideal one, the matrix loading one. Then comes the cavity loading systems where we have a lot of encapsulation inside. The amount of drug that can be loaded is very high. But the disadvantage is when we release it, once this system opens up, then all the drug gets out. There is no way to control. So for localized delivery, for example, if I'm trying to target a tumor, in that case, these systems appear the best. Or for that matter, a systemic delivery where the release of the drug has to happen quickly. So these two systems are quite ideal. So for a smaller number of particles, we can deliver a larger amount of drug. So there are advantages, disadvantages of all three of them. These are some FDA approved nanomedicines that are there, marketed, and the years that they were approved. So you can see from the mid 90s all the way up to the current age, we have several of them that have been approved. Then comes, as I mentioned, the particles, they are taken up through the epithelial cells. So there are different mechanisms. So we have phagocytosis, then we have macropinocytosis, we have cavillar-mediated endocytosis, then clathrin-mediated endocytosis, and then clathrin-independent and cavillar-independent. So independent of these two processes. And you can see that all these are dependent on the size of the particle. So for phagocytosis, it should be a fairly large one. This is the main reason why we choose nanoparticles over a larger particle system. So if you have large particles that are injected inside the body into the blood, for example, they are easily phagocyted and they are removed from because your body thinks that something is invading the body and they quickly try to remove it out. Whereas your nanoparticles will escape that mechanism, right? Then once they escape that, then they will be taken up slowly through various routes. So in this case, the second option is the macropinocytosis. So where greater than 1 micron, slightly larger particles will be taken up. Then the cavillar-mediated one, it will be about 60 nanometers. Then for the clathrin-mediated, about 120 nanometers. So depending on the size and the surface functionality that is there, we can have different mechanisms of uptake of the cells into the uptake of the particles into the cells. This is just the same thing. I'll skip this. The other part we have to remember is when we are dealing with polymeric particles, or for that matter, even metallic ones, the softness and the stiffness of the particle also have a role to play in how the particles move around inside the body. For example, if you have a soft particle, it's good for a drug release system, good for the easily internalized by the cells because it is pretty soft, so it somehow kind of gets inside. Deep penetration is possible inside a tumor. But then as it starts becoming stiffer, then the advantages are tumor accumulation is good and long circulation time in the blood. So there are advantages of having a soft one and a stiff one. So depending on the application and how the mode of the route of administration, one can make a choice of whether it would be a soft one, a stiff one, whether it will be a surface coated one, whether it will be a with a core and a shell kind of structure. So all these choices we need to make when we design a system. So usually what we do is we understand the disease condition first, where we want to do it, what we want to target, what kind of system is there, what is the local environment. Once we are thoroughly, we have a good knowledge of all of this, then we start designing our system, and see that if it can mimic a system, and then it goes in and does the job. In terms of nanoparticle drainage route, typically we have 4 types of clearances: the renal clearance, the hepatic clearance, and then the pulmonary clearance, and then of course through the lymph nodes, and through the spleen also. So we have kidneys, typically about less than 5 nanometers, then about less than 20 nanometers, it gets through this, right? And through the liver. The lungs itself, these is a separate route itself. This comes into here through the nasal route, and we have the alveolar macrophages that take care of it. Here, typically, the larger particle size are removed, and in the spleen, this is the last step through which the particles are removed, right? And they are macrophage. So here it is about 20 nanometers or slightly above that. So this is a chart that was developed by one of the groups, and so they did a very elaborate study. It was part of the thesis for this gentleman here, Wilson Poon, and they were able to figure out the effect of the size, how does it, what kind of flow chart can be developed, so that they know that if it is more than 5.5 nanometers, then it goes down. If it is less than 0.5, 5.5, then it straight away goes to the kidneys and gets eliminated. So if it is more than that, then it comes down. Either it can go to the Kupffer cells, like I just mentioned, or it can go to the hepatocytes or to the liver, and it gets cleared. And just to give an idea, since there is an audience, let's say a multidisciplinary audience here, when you want to, as Professor Navakant Bhatt also said, in this area, we need people from different disciplines, So we need engineers, we need clinicians, we need scientists, we need biologists, all kind of people are there. And of course, in the end, it is a regulatory bodies also. So we need to, all of us need to work together to come up with a solution which can be used in the patients or for the benefit of the patients who are the real stakeholders here. And as you can see, it is a multidisciplinary field consisting of all these areas, and all of us need to work together. And this is just to tell you the method, the time that needed to develop a system or a product. So typically it takes about, in the nanomedicine field, for the developing the drug itself, it takes quite a few years, maybe 5 to 10 years, and if it's successful, maybe 15 years. But beyond that, in our case, we are not developing the drug, but we are only developing a vehicle for delivering that drug, which is already there for efficient delivery of that. And that itself could take a few years, and then we go through the preclinical trials. Eventually, it comes out as a product. So it's a long run process. So in my lab itself, I'll switch gears now. I'll talk a little bit of what I do in my lab. We use a technique called as the layer by layer technique. We work with polymers, and we also work with mesoporous silica particles. And in the polymer field, so we have something called as polyanion, that these are charged polymers. So we have positively charged one and we have negatively charged one. And these can easily be assembled onto a substrate. So the substrate is to be charged first, and accordingly we'll have adsorption of these molecules onto the surface. So if you keep repeating this step, positive, washing it, then negative coating, again washing it, and keep going through this process, you will eventually end up with a multi-layer, which will have n number of layers. It's a slow process, but a very effective process. We can also do, if this is on a flat substrate, we can also do it on a spherical substrate or a template. So where we go through the same process of washing in between, centrifuging, then again washing, adding the next polymer, and so on. Eventually you get a multi-layered particle. So when we get a multi-layered particle, you can keep this core inside, or you can remove the core out to form an empty capsule. Of course, removing it has its own challenges. We have tried both things. The expertise is there with many groups in the world. But then when you want to scale it up, it can be a problematic step. So my suggestion based on my experience would be that we keep this particle inside, or we create a structure where the core is already removed. The driving force for this, for the buildup of these layers is primarily electrostatic attraction. We could use hydrogen bonding also, but electrostatic attraction is by far the main mechanism. We can assemble different kinds of materials, not only polyelectrolytes, but enzymes, colloidal particles, tubes. We can use them for different applications as I've shown here. So this is how we go about doing it. We take a spherical template, then we coat the polymers, then we remove the template out. In this case, this was a calcium carbonate template, so we could easily remove it using EDTA. And then changing the pH, by changing the pH, we can change the permeability of the layers here. This layer is about 7 to 10 or even about 12 to 15 nanometer thickness. So we can manipulate the permeability of that by playing around with the pH. So when I play around with the pH, so that means I'm changing the charge density of the layers. So when I change the charge density, I'll explain it in the next slide. So when I play around with that, I can put the molecules inside, I can close it again, and then release it at another pH. So washing is done at pH 3, then the release is done at pH 7.4. So you have at one pH where it is opening, you are putting the drug inside and closing it at another pH, and then releasing it at another pH. So you can play around with the pH and the ionic strength and manipulate the loading and the release properties. So this is how we do it. So these are the various polymers. We have a strong and a weak polyelectrolyte. Just quickly to explain what is a weak and strong. The weak one responds to pH. The strong ones don't respond to pH. Both are charged polymers, but one will respond. That means the charge gets modulated based on the pH. Whereas the strong one, it doesn't refer. So the charge remains same throughout any pH. So that's how we do it. So we take a strong polymer, let's say PSS, then we take a weak one, and we can manipulate the charge. So for example, here pH less than 6 for PAH, this is positively charged. But then when I increase it to beyond 8, it becomes neutral, right? So similarly with the PAA, pH less than 5, it is neutral. And then P greater than pH 5, it is negatively charged. So I can manipulate the charge based on the pH. So depending on that, what I'm trying to say is you have a pH range where we have a positively charged polymer and a negatively charged, and then I can assemble it. So if I manage to change the charge in this layer that I just showed you in the previous slide, if I can manipulate the charge in this shell, then these will start repelling each other. So what is happening now is, by changing the pH, I have neutralized some of these positively charged. So you can see now the positive charge is less here, negative charge is more. So when the negative charge is more, then they start repelling each other. So when they repel each other, that means the permeability is increasing. So the flow of the molecules from inside to out or outside to inside can happen, right? So if I change the pH back again, then the positive charge comes back and then they lock again effectively. So they close the pathway. So this is a very nice way of loading and release. But the only problem with this system is that once it starts releasing, it will release all its cargo. So these are the different routes of encapsulation. So I just mentioned, we make a capsule, we load it by changing the permeability, and then we lock it inside, and then finally we release it. So we have porous spheres like the mesoporous silica I was just mentioning. So here we could put the drug inside, then coat it through LBL, and then either remove the core out like this, or we can keep it at this stage. So in my lab, we normally operate at this stage, but we have done studies with this type of system also. So I would like to show. So the release part I already mentioned to you earlier. So we can use optical means, mechanical means, ultrasound, then chemical means, enzymes, electric, all these strategies could be used to release the encapsulated material. This gives us a lot of control in how and where we want to release, at what time we want to release it. So that is the beauty of using these kind of systems, especially at the nano sizing. So let me give one example, two successful examples. One will be with the bacterial system, and one will be with the cancer system. So I'll quickly go through it. So here we have used chitosan and dextran sulfate primarily because they have two different pK values. So they can be assembled at pH 5.6. The loading is very high, 78% loading. We could load about 312 micrograms ciprofloxacin, which is antibiotic, in 80 microgram of the capsule. So that means almost 4 times the weight of the capsule itself, we have loaded the antibiotic in. So we follow these, we characterize them using a microscope, scanning electron or transmission electron microscope. Then we measure the size, then we measure the charge on the surface to monitor the growth of the layers. So here, not going too much into the biology part, I'll quickly explain. The Salmonella typhi causes typhoid in humans. That's what we have when we are exposed to it. Whereas, but if I want Salmonella typhimurium, that is the one that infects the mice and induces typhoid-like symptoms. So we have to use both of these. So normally in our animal work, we end up using the typhimurium. And the urine salmonellosis model is well-established model of typhoid, and we have determined the. So this is a chitosan, dextran sulfate, and the cipro that is encapsulated in it, right? So first we start our work with cell lines. This is what we call as in vitro work. For the animal models, we call them as in vivo work. So the in vitro work, we started showing that the CD cipro has the same. That means the number of cells that are there, the salmonella cells are very few. Most of them are dead, as it is with the free cipro. Similar things we could see with the raw cell lines, which is another kind of cell line. We then work with both the typhi and the typhimurium, and we could get similar numbers. That's fine, using the same cell line. But the most important part was when we use a free drug and when we use the encapsulated one. So the cipro refers to the free drug. This refers to the encapsulated form. So you can see now the free drug in the plasma, in the molecule, is very in the cell itself, is very high initially, and then it goes down quickly. It goes down quickly. Whereas in the encapsulated form, it is low first and then slowly it increases. What this means is that the encapsulated one is releasing the drug slowly once it enters the cell. So it is the drug concentration will be present at the required concentration. The amount of drug at the required concentration will be present for a longer amount of time as compared to the free drug. That means that should translate to a better efficacy in terms of cell death. So same thing we could see in the raw cell lines also. So we wanted to now make sure when we do the animal models, what happens to the amount of drug that we give and the number of doses that we give. So there are two things that we need to consider. So we infected the mice, created a model system, and then started using the different formulation that we had. So we had the CD cipro, then we have the empty CD as a control, and then we have, of course, the free cipro. Then all of them are injected intravenously. So we have three things: multi-lymph nodes, then we have spleen, and then the liver. So we have three different systems that we monitor, organ systems. So what you can see is this is the only infection, So you can, this number you follow, this is the highest number that we get because it's only the infection. So this is, here we look at the CFU per gram weight of the organ, that is the amount of bacteria that is there. Now, when I take CD cipro 2.5, then the free cipro of 2.5 and 10. So you can see that 2.5 and the 10 one, you get a number something here, in this range. That means the burden has reduced now from here to here, correct? Whereas with the 2.5 of free cipro, it was still much higher. So similarly, you can see that if you look at the other organs, CD cipro 2.5 and cipro 10, you get similar results, and same thing with the liver. What this means is you are using 1/4 the concentration in encapsulated form, that is the ciprofloxacin. And then in the free form, it is more than that. Let's say this is 10 and this is 2.5. So you are getting similar efficacies now in terms of the cell death or the amount of bacteria that could be killed. So you are already reducing the concentration of the drug by almost, 3/4 you are reducing. You are now at 1/4 the concentration, but you are getting similar results. Now, when we look at the number of doses that we give, the once per day or twice a day, 12-hour interval, right? So you can see the CD cipro is given only once per day and the cipro is given at 12-hour interval. That means 2 per day. So then you start seeing again similar numbers. Same thing we see in spleen and similar results we see in liver, right? As compared to the only infection. So that means the encapsulated one requires only one dose at 1/4 the concentration that is needed, as you get from the left graph, as compared to the free form, which needs 2 doses and then at a much higher concentration. So we were able to safely establish through a very detailed study with the help of our students and arrive at this conclusion that encapsulation is indeed very good for delivering antibiotics. So we did further studies with ceftriaxone, similar studies. And then we did a detailed study to understand how the distribution of the drug is inside in the plasma. And then we also looked at the survival assays. That means whenever we do animal model studies, we want to see all the mice survive the test. So depending on how many survive, we can say that this is good or this is bad. We arrive at a conclusion. So in this case, the survival assays, we see that in the control, the MTCD and the CIPRO, there were deaths. Some mice died. But in the CD-CIPRO one, all the mice survived till the end of the experiment, which was about roughly 14-15 days. And then we do a detailed study of the distribution of the drug in the different organs. So the area under this curve will tell us the amount of drug that is there. So one can easily see that the drug concentration was much higher availability. And so you can see here, so the AUC, which is the concentration. So in CD-CIPRO, it was all high as compared to the free drug. So there's a considerable increase in the drug concentration of by 60, 70. In this case, it was in lymph node, it was 150% increase. And this is finally the summary that we do, what we call as a pharmacokinetics and pharmacodynamic study, PKPD. And the half-life has gone up significantly. The clearance has decreased. And the ratio, there's a Cmax by MIC, the minimum inhibitory concentration. This ratio should remain same. That means it will always tell us the effectiveness of the drug. So in this case, it has remained same. So we were able to monitor these numbers and safely conclude that encapsulation of antibiotics is another approach of increasing the effectiveness of the existing antibiotic itself. Of course, there are other ways to do it, in developing new antibiotics and things like that. But in this case, we took existing antibiotics and showed that they are better off. Because the more antibiotics we use, we are going to develop drug-resistant bacteria in the system, in the environment. So we continued this with intracellular treatment of salmonella using arginine-coated molecules. And we were again, I'll skip these slides. I'll show you one set of cancer results, treatment of cancer. But I just want to show here that the arginine functionalized one as compared to the amine functionalized, you can see the uptake was far more as compared to the amine functionalized. That means by having a targeting moiety on the surface of the particle, the targeting and the accumulation of the drug, co-localization of the particles in the cell or around the vacuole is much higher as compared to the non-functionalized one. And we could also see that the weight of the spleen, which is the final destination or the final place where the bacteria come in before being thrown out. So the untreated one, this is what happens. When you have an infection, this is how the spleen look like. And this is how it is when it is not infected. This would be the size, original size. During infection, it becomes like this. So we need to bring it down to this size. And in this case, when we have the arginine functionalized one with the encapsulated version, we were indeed able to bring down the size of the spleen, which clearly says that the infection has gone down significantly. So again, we did the assays here. We were able to clearly show that the encapsulated version, all the mice survived. But here I would like to show you one interesting result. This 52 week mice represents a 3 days post-infection. Okay, sorry. A 52-week-old mice represents a 60+ year patient, right? A senior citizen, I would say, senior patient. And normally it is a senior, when it infects a senior person, they would end up getting pneumonia. In fact, currently the example, if I should give, the Pope is suffering from a double pneumonia. And that is because they cannot respond to antibiotics when at a very old age. And we mimic that also using a 52-week-old mice. And in this case also, we were able to get successful treatment of the mice. So that clearly shows that in the initial stages when we treat, in the serious stage when we treat, and then with the senior people when we treat, in all the cases, we were able to successfully prove that encapsulation was much better, or in fact very superior as compared to the free form. Coatings we did with LB with probiotics, but for today's lecture, I think due to shortage of time, I'll skip it. I'll give one example with our cancer results. So here again, we prepared particles, albumin particles, coated it with the LBL layers, right? and made it something like this. Here the core is intact now. The core is not being removed. The drug has already been encapsulated in this, which is doxorubicin. So this dox, what you see here is what is known as doxorubicin, which is commercially used molecule for treatment of cancer. And when you precipitate along with the drug gets encapsulated inside it, right? And then we functionalize it so that it is specific to breast cancer cell line. So we did the initial characterization, loading, etc. This is how the particles look like. Typically about 100 to 150 nanometer, I would say, diameter. Now, these molecules are sensitive to something called as trypsin, which is an enzyme. So it can be triggered by change in pH, right? There is some release, but then the highest release happens when there is presence of an enzyme. So you could use a combination of pH and enzyme to trigger the release, or you can even make it more effective in such a way that it doesn't respond to pH, but responds only to the enzyme. Then we were able to show the uptake of the doxorubicin, right, using different formulations. So one can see the HA terminated one. That means the outermost layer on the particle is hyaluronic acid. And in another system, the outermost layer is the polyl lysine. So in both the cases, but the hyaluronic acid one was the highest uptake. See that, this peak? So that means your drug along with the particle which is terminated with hyaluronic acid enters the breast cancer cell line very effectively, and you can see maximum concentration of the drug inside the cell. Okay. But whereas when you block this mechanism, there is something called as CD44 receptors on that. If you block them, then the uptake is substantially reduced, right? As compared to the lower concentration. So because the doxorubicin is naturally fluorescent, so you can look under a fluorescent microscope and we can easily see that the fluorescence is quite high as compared to the other formulations. Now, of course, we also look for cell viability. I can skip it for the time being. We can, if somebody wants, I can always answer it much later. But we look for the cell death. So apoptosis is a mechanism by which the cell death occurs. And if you look at that, the HA terminated one had the maximum cell death, as compared to the other ways. So compared to free doxorubicin, we have now increased it roughly from about 5-6%. So we have now taken it up to close to 20, almost 3.5 times increase in the amount of cell death that is taking place. And that is because what we call as IC50 value has been reduced drastically from 0.43 to about 0.26. You can read about some of this, because in 1 hour, I think it's very difficult to explain. But the importance of this comes finally in the treatment of the tumor. So we do animal model studies, we induce the tumor in the mice. That's how the tumors look like here when we harvest them at the end of the experiment. So you see the plasma concentration, blood concentration, free dox, and then the encapsulated version, much higher amount of drug available. Then the amount of drug in the tumor itself is way higher as compared to the other organs. That means we have been able to selectively target the tumor. And then when we monitor the tumor volume as a function of time with the different formulations and a control, right? In the control one, that it is growing continuously, the tumor. And then when we use free dox, it is reduced to some extent, the growth. But then when we use the encapsulated version of the doxorubicin, you can see that the tumor volume has started reducing, which is now visible in the harvested tumors that you see on the right side. So this is the one with the control. This is the one with the free dox, and then this is the one with the encapsulated version. So this clearly shows that by encapsulating and targeting, I can now achieve, using nanoparticles, I can achieve a much higher efficacy in treatment of the cancer. In this case, of course, it is a tumor-based one, but we can target different kinds of cancer. We have done work with lung cancer. We have done work with other kinds of cancers also in our lab. So, and around the country also, we have several researchers who work on this, including Professor Rohit. So I'll skip this part. It is an extension of the existing work only. So here again, we were able to convincingly show that it is indeed selective to the tumor, and then the capsules, the tumor itself has reduced significantly. So this is a summary of all the capsules that we have in our lab that we have developed over the years. And of course, I have collaborated heavily with my colleagues in the department, in the institute. And then, of course, the funding agencies that have been there always supporting us, our work. And these are some of the students who have graduated. Currently, the last 7 of them are in my lab, 8 of them. And a few postdocs are also there currently. So I leave you with some images of our campus, beautiful campus during the rainy season in the night. And then during March 3rd, which is Founders Day, on which we celebrate Jayant Tata's birthday. This is how the campus looks like, all decorated. And then a beautiful evening, when we go out for a walk. Okay. So these are the people who were instrumental in setting up our institute. I'll explain that on some other day. And this is how the campus looks like. So with that, I think I end my talk. Thank you very much. Hello?
Sir.
Yes.
I think 1 or 2 questions were there. So I think due to shortage of time, you can answer those questions through email, sir.
They can send me an email. Anybody can send me an email. I'll be more than happy to answer. If they want to connect to me on call also on another day, I'll be happy to answer it.
Yeah, I think it's better, sir, because 3 persons they have sent their questions. I think it will be answered through emails.
Yeah, sure. Thank you.
Thank you, sir. Thank you for your valid presentation on utilization of nanotechnology in medicines. Thank you very much, sir, once again. And now I request Professor Rohit Srivastava from IIT Bombay, Mumbai, to present his presentation. Over to Professor Rohit.
Yeah, thank you very much. Let me share my screen.
Thank you. Yeah, please go ahead. Share your presentation.
Just a minute. Yeah. Can you see my screen?
Yeah, visible.
Yes, yes.
Please go ahead.
Yeah. So thank you very much once again. Thank you, Professor Aichur, for inviting me for this talk. I readily accepted because I knew students would be there, and I want to show some things that we've been doing that can enthuse students to do what we have been doing in the past and how India can benefit from it. So once again, a warm welcome to all of you. My name is Rohit Srivastava. I'm a professor in Department of Biosciences, Bioengineering at IIT Bombay. I'm basically an engineer, but then joined the biomedical engineering faculty at IIT Bombay because I had training for doing bioengineering work for my master's and PhD. Now, what I'm going to talk about in the next 30 minutes or so is translational applications of nanotechnology and materials engineering. Professor Aichur has given a very, very nice overview of work being done in his lab, starting with basics and going all the way to applications. I'll take off from there. I'll talk very little about the basics because I know that's been covered. And I'm going to show you applications. And then I'm going to also show you what can be done using these sort of technologies. So I come from IIT Bombay. For many of you who don't know IIT Bombay or have never visited IIT Bombay, there's a terrific ecosystem at IIT Bombay, very much what is present at IISc Bangalore, at IIT Madras, at IIT Delhi, IIT Hyderabad. Many other IITs now have similar ecosystems. What one should keep in mind is that
Rohit, can I interrupt for a second?
Sure.
Can you hide that thing, that bar at the bottom?
Yeah. Thank you. Yeah.
Thank you.
So suddenly the entire thing went over. Yeah. So now is it fine? Yeah.
Yeah.
So,
Yes.
So if you see these blocks, I usually show these blocks just to tell you that we alone cannot do most of what you see out of a lab's work. And this is exactly what Professor Aichur mentioned. Many of us need to work together to make a final product. And if you look at these boxes, you'll see that there are engineering departments, there are science departments, there are translational centers, there are many other parts that come together if you have to make a product or go all the way to market or even license your product to a large startup company, large industry. Now, what is important to understand here is finally we are going to be adding to the capacity in the country. We are going to create high value jobs, or we are going to create some affordable healthcare technologies. And with that in mind, our department has been doing translational research for several years. Many of us have set up companies, and there are many of us who are successful or ultra successful. So Professor Rahul Purwar's company, for that matter, from our department, which works on CAR T cell therapy, which also Professor Raichur showed in his presentation, is also a technology which has been indigenized in India, and now the company is worth about 1,000 crores. So you can imagine that coming out of an academic setting, you can still set up a $1 billion company in India. Of course, it has not reached $1 billion, but it will. Now, if you look at the medical device industry, now this is one slide I really want you to focus, because as students, you should know where the gaps are, and then you can then figure out what you would really want to do for the country. Now, many of us went out, we studied outside, we came back to India. Why? Because we wanted to contribute to India. But even though we've been there in India for the last 20 years and contributing whatever small way we have, you still see this big gap there. Indian medical device industry is a huge value in this country. It's about 90,000 crores, but then 80% of this is still imported, which means that the government is seriously struggling with getting funds, or sending money, basically, you have to spend all this money just to get these products in India. We are losing our foreign exchange there. Now, what do you do to do that? And one thing you have to keep in mind is that of all the healthcare spending that typically a family does, you will see 70% is private spending and only 30% is public spending. And most of us can resonate with this, saying that, most of us don't ever go to a government hospital setup. Even if we do, even if we are asked to take scans or get reports, we will go out and get it done privately, which means that we have to also be aware of the costs associated with it. You have to also be aware of the doctors that are available to treat our population. You have to be aware of our diagnostic ecosystem. You have to be aware of many, many challenges that India faces, why our products are not able to reach the last mile. Once you know this and you figure out that these are the gaps that we need to work on, then you can figure out potential solutions. And many of those solutions have been worked upon. I have been there in several committees looking at how do we make products, how do we make sure that these products reach all the way to the end stage, which means that you are able to now service the tier 3, or the primary healthcare centers, the rural healthcare market. If you can do that, then there is a big market out there. With these things in mind, we set up our lab many, many years back, and we've brought many technologies to market. So the center part that you see is technologies that have come out of our lab, many of which are commercial products now, and many new areas have been added on to our lab, in the sense that we started out with nanotechnology, which Professor Raichur just mentioned, and a lot of nanotechnology went into making such technologies which could finally reach the sort of market. But then we figured out that there is a lot more that we could do based on expertise that you as students bring into our lab. And I started learning from students. So I started looking at different technologies. I learned microfluidics, I learned digital health, I learned point of care devices, technologies for maternal health monitoring, technologies for pain management, and so on and so forth. So you'll see many, many technologies that have come out of our lab are now looking at the entire end-to-end sort of servicing and looking at how we can learn from each other to put more such products in the Indian market. As you can again see, I am not doing this all by myself. It is my students who've done this. And from the bottom till the top that you see, all these are my student companies and companies which came out of our lab, which made sure that each was able to put 1, 2, 3 products in the market. And these products came out of our lab in the sense that it started out as a master's project for them, started out as a PhD project for them, or started out as an internship project for them. So I'm saying this once again, that you need not be a student in in an IIT system to be able to work on products. You can even do internship in a lab like Professor Raichur's or Professor Navakant Bhatt's or ours or Professor Suman Chakravarti or many, many more labs in the country which work on translational technologies to be able to work on a technology and get it to market. Now, one such example is the depict one you see at the bottom, which is a company for a short-term intern who worked in my lab, worked on a technology for assays for soil monitoring, went to Denmark and set up a company there. So you can imagine, and now she's raised about $10 million in the company. So you can imagine, if you can do all this sitting in a lab which has access to this ecosystem, how much is possible? And this is exactly why I wanted to give this talk today. Now, some technologies which became a big name from our lab are the ones shown here. The UCheck in the center was the first example of a mobile phone being used for diagnostic in this country way back in 2011. And this was when mobile phones were not even there in everybody's hands, but we had actually thought ahead by saying that, look, we want to use the Android mobile phones and later the iOS systems to be able to use them to take images of our strip and then correlate those color changes to built-in values so that we could give you absolute values of the color pads on the strips. And this was for urine analysis. And later we have even expanded to other parameters which could also look at infections in urine, which came out of another student's company, which is now doing very well in the Indian market. So the one on the right side is our own glucometer, which hit the market in 2013, using strips which were made indigenously, but at a price range of 5 rupees in the Indian market. So this is something that actually revolutionized this country in the sense that it showed that people could actually work on technologies which could go all the way end to end from a lab to the market through student companies. Now, once we had done that, we knew that we had figured out the chain and we had figured out how to do it. Now we need people like you, is why I have been supporting so many interns in my lab, so many students who come work for a short time in my lab, contribute for their expertise. We learn from them, and then they go on to actually do much bigger things. So we've set up some I'm giving you just 3 examples of these student-led startups which became big names in the Indian healthcare industry, which are still doing well. Biosense Technologies is one of those which came out with these multiple products. They were finally taken over by Tulip Diagnostics. Finally, again, they are taken over by a multinational, and they're part of that multinational the chain. The founders have now gone on to set up new companies, which are again working on newer technologies. Neodox is the most recent one from my lab, from a student who worked in my lab for about 10 years. As a second-year undergraduate student all the way till today, he's still working in our lab, through our lab, and he's brought out these smart test kits, which you can take an image with a mobile phone, the data gets analyzed, the report gets shared with both the clinician as well as the patient, and you can also do analytics on the data, which means that you can make it smarter and smarter as you go along. We've also got Doto Health, which is my PhD students' startup company, which now has presence in multiple countries. Imagine this, coming out of India, if you're working on a problem statement that not just India can benefit from, but other countries can also benefit from, there is a big market out there that you should also try and capture. And these are students who have worked in my lab, keep working even today from my lab. They've already reached 1 million women in this country, which is in fact a huge number that they've been able to service. And this is for looking at maternal health, looking at digital fetal and labor monitoring sort of technologies that have been worked upon from my lab through an Abdul Kalam Technology Innovation Fellowship, put into the market, and then now getting traction in the Indian market. Now, this started me thinking, why did I show you these in the beginning? Because I wanted you to understand that many of this have been led by students, people like you. But then there are some which we also need to lead. And this is where I keep taking example of Professor Rahul Purwar from my department, who took that first step of taking absolute ownership of a company, putting his 100% into that company. And today that company is worth 1,000 crores. Now, I did the same. I set up multiple companies. I'm going to show you some of those. The first one is actually a nanotechnology based company, in the sense that a lot of work went in our lab, as Professor Raichur also showed, which forms the basis of any startup that comes out of a lab. You have to have deep science behind it. Remember that. You cannot just start a company based on an app and then say that it is all deep science. Apps are fine. People do well with apps, but probably the real reason India needs these sort of startups is because there's a lot of deep science in this country being done at not just the IITs, the ISCs, the ICERs, and many institutes in the country. If we are able to get this deep science into a startup, then probably one day we will have enough products in the market that India can benefit from. So me and Professor Bellare have been working on many of these technologies. A bone graft material, which is now reaching the market after about 2.5 years. We've set up a 5,000 square feet GMP facility. And this is going to manufacture this bone graft, be able to put this into production and put it out into the market. It's a huge technology being led by Dr. Kunal Khanna, who's our PhD student from our labs. And this guy is leading the effort to put these products in the market. The second is our resorbable screw. I'll show you some from that material. But screws are something that have been done over many, many years. There's nothing that we did differently. We started out with a project sponsored by the DHR or the one arm of the Ministry of Health, where they were funding such translational work across the country. We started looking at these low-cost, indigenously developed bioresorbable bone screws and soft tissue fixation application sort of materials. We started looking at what was there in the market. So this should be our first step. First of all, you figure out the need. Once you figure out the need, then you look at where and what is being currently used in the market. And we found that Smith and Nephew interference screws are there, Stryker, Zimmer, DuPois, name the companies. All these large multinationals are selling screws in the Indian market at more than 15,000 rupees a piece. Can you believe that? One surgery, if you use 2 such screws, you're already 30,000 rupees in consumable cost. And then let alone the operation cost or the hospital charges. Now, if we could do something in this area, I think we could make a big impact, which is why we started looking at first, what are the problems existing? If there is a need to that, then how do we find a solution to that? And our solution was that we would now take different materials, and this is the one where we use nanotechnology, the one in the center. We are using these magnesium oxide nanoparticles, which are being used as fillers in our polymer matrix, which Professor Raichur also mentioned. We are making these PCL matrix, which are slow degrading. You add silk to it to make it, stiffer and to, add strength to it. And then you add the magnesium oxide to give it some compatibility, bacterial properties, even make it a little bit more stiffer, and as trying to get the same strength as a metal screw. Of course, you'll never get there, but how far can you do with such polymeric screws? Can you now tune the property so that it degrades over a period of, say, 2 weeks or so, 2 months, 3 months, 6 months, and something of that sort. So we went ahead with this, did our injection molding, got our screws. So that's the screws that you see on the right left-hand corner. We also had to look at what was the novelty in our process. Remember, you'll have to file a patent around it, because once you have a product and you don't have a patent, anybody can come and copy you. So you have to have some moat around your technology that you will be able to then use this to go into multiple countries. So we have now not just an Indian patent, but multiple country patents, which have all been filed by ICMR. And we've been helped by ICMR to scale up this technology, to actually set up a manufacturing for this, so that we can now move ahead. So our USPs are there. Whether we reach the market in the next 2 years, whether we are able to create an impact, only time will tell. But this much I'll tell you, that if you take the right problem statements, if you find the right need, then there are enough ways that you can find a solution around that need. You can also find what other people are doing. You can also find ways of making it novel so that you can file a patent around it and then move forward with commercialization. So my hope is that very soon this company will have multiple products in the market. We are already valued at about 50 crores or so, which means that this next round of raising that we do will probably go beyond, say, 200 or 300 crores. But that's something that I don't care too much about. More I care about is the impact it creates. got a second company floated. And all these companies I'm a co-founder in. I'm either holding a director position, which means that I hold at least 30% shares in the company, or I will have non sort of executive position, but then I will also hold enough shares in the company that I can actually make some decisions for the company and not let it be taken over by a multinational. So we've got our second product, which is looking at how to create this liquid-based assay for glycated albumin. Professor Navakant Bhatt's group has already done that through Path Shodh, which is his company. And I'm sure that there are many, many, many more technologies that we can do based on what we have learned from people like Professor Navakant Bhatt. So we've got another company. I'm not going to show you more details on this, but just tell you that there are a lot of things that you can do. Now, where nanotechnology comes into play is in our third company, which we've floated very recently. We've already raised money for this company. It's already a valued company for investors, and we are getting a lot of benefits by working with partners like ICMR, with BIRAC, with of course our own incubation agency, and then which is SIGN at IIT Bombay, and multiple partners. We've worked on a cardiac marker, which is troponin INT, and we've made products now which are as good as the ones that exist in market, which is the ones being sold by Roche. We've also looked at glycosylated hemoglobin. We've also looked at thyroid markers, and so on and so forth. Where does nanotechnology come into play is where we've just let me go one slide up and then come back. So we are using these lateral flow assays to create these strips. And many of you are aware of lateral flow immunoassays because they became a big product during COVID times, where people were using them to look at either antibodies or antigens. You could have either of these lateral flow immunoassays, but the core principle being that you have gold nanoparticles which are conjugated to either antibodies or they are conjugated to antigens, depending on what you're looking for in the blood. Now, these gold nanoparticles are the ones that you make in your lab. You actually commercialize. You don't have to buy them off Sigma or some vendor. You can actually do it in your lab using the Turkovich method. But once you can do that, once you can optimize that, then you put them on strips. You attach the antibodies to them, and when you flow blood on these strips, you will be able to sort of see. So if you see these images, you will be able to see the second line glowing. The first line only shows you a control, which means that your strip is working. But the second line, as it becomes deeper and deeper, it will tell you whether more and more of the analyte is present. And we've been able to do that with multiple analytes over the years, not just thyroid. We've also shown that with A1C, and we've got a reader as well as an assay around it. So remember, you can make assays very simple, but unless you make it quantitative, unless you make sure that somebody can read these values and get absolute numbers out of them, there's really nothing much you can do for competing against products in the market. So you have to make sure that you do that. We use a beautiful ecosystem at IIT Bombay, which is the BETIC ecosystem, Biomedical Engineering Technology Innovation Center, which goes end to end, helps us with manufacturing, helps us with ISO 13485 testing site, as well as with getting the CDSCO documentation in. We've made several products through this, as you can see, readers around it, assays which work, which have been tested or validated in hospitals. Once you do that, how do you then put all this in a product format and then push it through a company? So while our readers look like this while they are being made, this is what it will look like when they are finally out there. So, you have to also think about product designing, because a crucial part of how do you have a product in the market is also how do you present that product in the market. And that's our sort of third company. We've also floated another company for looking at lipid assays, and this is a final product which is now reaching the market. It is already into CDSCO manufacturing license process, which means that we are ready with all the data. We've completed manufacturing. We've shown pilot manufacturing. Now with the approval coming in, we should be able to set up our manufacturing. The idea is that using 1 drop of blood, can you now look at total cholesterol, HDL, LDL, and triglycerides in a point of in 1 drop of blood. Started out with a simple project from BIRAC, and many of you can apply for these projects as an AIR scheme, which is an academic innovation research scheme. Move on to getting more and more sort of inputs into from BIRAC as to how to make your assays, how to actually make sure that your assays can be tested, make a device around it, look at stability of the assay, look at how do you compare your assay with commercial readers out there in the hospital. So we did it at KEM Hospital in Mumbai, at Sion Hospital also. We just finished up the studies. And in all our cases, we have less than 10% variation between our data and hospital data. Once you do that, then you should be able to get ahead and then submit your data to CDSCO to get an approval. We've also had to set up a pilot manufacturing for a BIRAC CRS grant, showing that we can make these strips, package them, and then be able to make multiple devices so that these devices, and this is just a pilot batch manufacturing, but you can see that if you can do this, if you can show that you can make pilot batches, then rest assured that CDSCO should give you a manufacturing license to be able to move forward with your company. But look at what I have learned so far. I've learned that there are many things that you can do in your lab, but many things that you need to do with the company, because the company is authorized to file a test license to CDSCO, to file the data for the test license, get a manufacturing license, actually set up manufacturing, have an ISO site where all this is either manufactured or assembled or even tested. But then you have to do many of these things through somebody, which means that somebody is either your own student or yourself who has to take that lead. And in many of these cases, I have done that. Set up a new company around pain management. I saw Professor Raichuru also mention about microneedles as one of those technologies which have come a long way. Now we've mastered the art of creating our microneedle patches, which are these polymeric patches, but then we've loaded them with an anti-inflammatory drug, and hopefully with many of these analgesics which can be loaded for over-the-counter applications. Now, our idea is that we've already set up a company, we've already got grants for this company, we're now already valued for this company, which means that we now have to move this product all the way from where it is into, say, we've just finished preclinical studies, but then we have to also go ahead and do a phase 2 trials. Phase 1 not needed from the CRO that we talked to, because we are using materials which are commonly used, which are FDA approved materials. So you have to also keep that in mind, that you use materials which FDA has approved, so that you don't have to go through the process again. But if we can do that, we can also make sponges. And Professor Raichuru also mentioned some of these polymeric materials, if you remember. You can use those polymeric materials to either make microparticles, nanoparticles, or just load these microparticles into those polymeric sponges and then release the drug slowly over a period of time. So we started looking at an application where we did a lot of work for treatment of orthopedic implant associated infections, and we put that in a company so that this company can take that product forward. We've also got our inflammation responsive hydrogels, injectable hydrogels, which can also be looked at, used for post-surgical management. And again, look at the need statements that this country has. You have so many things that you can work on. The only thing is, how do you take it forward? How do you make a product out of it and then put it into the market? Of course, we can now make these microneedles. We can make them sharp enough that they can penetrate the skin. You load them with drug, they will actually go in, release the drug as they degrade, and then you should be able to get 100% release in your skin, compared to at least 50% losses when you use those transdermal patches which are available in the market. We've also got the same idea, using microneedles, but then with a polymer layer on top. Can you now make smart wound dressings? See, these are going inside the wound, acting as scaffolds for the wound to heal faster, because cells can come and attach there, tissues can form, the skin can be repaired faster, or the repair process can go faster. Can you do that? Can you now load these with growth agents so that you can facilitate faster healing? We've also looked at products where you can now use those sponges in maxillofacial applications. Remember, I'm showing you just one part of it. This is one application out of hundreds and thousands of applications that you can think of. This, why we've picked out, is because we have a maxillofacial surgeon working with us who's given us this idea that you can load these with drugs, release the drugs over a period of 3 to 4 days. Again, you use micro and nanoparticles to release drugs, but then how do you get them degraded at site? How do you clot the blood? how do you use materials which you can patent? How do you actually move this product forward? So many challenges as you move forward, but many things happening. We've also set up a company around reproductive health. And this is something that many of us are not aware that this is going to be a big challenge for our generation, or the generation which is coming after us, for people who are going to struggle with mental stress, who are going to struggle with stress at their workplace, and then have fertility issues as well. So we've started targeting this for men's fertility, not just women's, because women's, most organizations are already doing that. We thought we'll make a different company for men's fertility sort of applications. And we made a gel which can be used either pre-coitus or in vitro applications in many of these IVF clinics, which can then benefit from getting hyperactivation of the sperm so that they can then be implanted, and you can get up to 80% sort of reproductive chances with a single step. We've also set up another company around remote healthcare monitoring. So you can see I have worked across the domain. My domain knowledge may be just one, which is engineering, electronics engineering. I do a little bit of devices and diagnostics. But then I have learned a lot of these things with students like you. And I feel that if I can do it, I think anybody can do it, in that sense that all of us have access to good students, to people who come to our institutes who actually contribute such a lot and make such products. So we had a student in my lab who's a medical doctor, worked on several technologies. In 3 years, he filed 50 patents. 50 patents. Can you believe that? In 3 years of his PhD. With that 50 patents, now we have at least 30 technologies moving forward, because many of these are copyrights, and trademarks and stuff like that. But many of these are core technology patents, which means that if I can now use them into a startup, I believe that it has a potential to move forward. This is again another startup around remote healthcare monitoring. We got another startup around, again, point of care diagnostics, but looking at, anemia in general. So we are looking at a device which can look at ferritin, which can look at hemoglobin, which can also look at iron binding. And all of this being done in one device using a set of strips or even one strip. Can you now make a product which can be used for anemia screening and applications for women's health in the country? Also set up another company around pain management. Now, pain management, you had seen one company which was looking at microneedles. Can I now look at electronics and make a pain management device? Can I now make a smart pain management device? So the same principles go into all of this. You have to have a sponge. You have to have microparticles. You have to have drug-loaded sort of microparticles, which will release slowly over time. And that's where your nanotechnology applications come into play. But most importantly, you have to link this all up with a smart device, which means that on a press of a button, it will release the drug into the skin. How does it do that? Using iontophoresis. If you're not aware of this, just a few words on it. It uses electric current to push the drug into your skin. So depending on polarity of the electrodes, the drug of the opposite polarity gets pushed into the skin. And that's how iontophoresis has been useful in many countries. Today, people are using that to make many products. We've also set up another company around hospital products, and we made a smart a syringe cap protection device, a needle stick injury protection device. We made a smart IV fluid monitoring device, and many technologies. So you can imagine that there are, we're just on the tip of the iceberg. If our lab has worked on 50 technologies in the last, say, 20 years, then there are at least 500 other technologies or 5,000 other technologies that we can do in India. Can we now ask for maybe 5 million other technologies? Even if one student picks up one technology as his goal for India, believe me when I say this, in 5 years, India will be free of imports. But that's the way we should all work. And we've got another product in a startup for a respiratory health monitor. And this is a combined device for a spirometer and a nebulizer. I'm not showing too much about it because, I'm running out of time. But we've sort of made another device for a non-invasive ventilation mask, which has a feeding port in it. Again, this is something that does not exist in the Indian market. You have to have a bio-design process, figure out where the need is, filter those needs, find who will benefit from this product and then see whether it has not just a patient value, but a commercial value as well. Once you do that and you make a product, then I'm pretty sure that product will be successful. Again, an app-based company. So if everybody is doing that, why not me? And why not involve people who know more about this than myself and make a mobile application? So we've got doctors in this company, we've got technologists, we've got designers who've made a mobile application to digitize logbook entries for doctors, and it's just getting released live on Android and iOS. And I'm guaranteeing that this will be a big product because there is a lot of benefit out of what they have offered. So we've transferred technologies in the past. We've just transferred, last year we transferred this digital stethoscope technology through Indian Navy to Yashraj Biotech Limited. They have finally made the product complete. It's a beautiful product. It has sound quality which is better than the 3M Littmann stethoscope. It is better than what exists in the Indian market, and at least 1/3 the cost of what exists in the Indian market. That's our game plan. You have to do something disruptive for this country. If you can do that, if you can make products, even do a price innovation, I think this country will benefit a lot. But even if you do that, can you make it better than what exists out there and make products that go through that entire life cycle of creating such products? So we've released this product last year in New Delhi in a very, very large function, and it was actually released in a large function in New Delhi where the Honorable Defense Minister, you can see him on the right side, we also tested this stethoscope on the Honorable Defense Minister. He was actually very happy listening to this sound quality. The person testing it on him is my own PhD student who's done that, and this is an Indian naval officer. So many things come out of our labs. We also work closely with the Betic ecosystem. I'm going to close up in the next 2 minutes. But with all the work that's happening in IIT Bombay, feel free to look up some of these ecosystems, because this is how we are facilitating end-to-end sort of development for medical devices. If we can continue doing that and continue adding value to this country, I'm telling you, in a few years, India will be free of imports. We've already touched multiple million patients. Hopefully that number will keep going up. And many, many, many startups have come out of it. You see the startup names in brackets, but many of these technologies are coming to market. We also run a biodesign fellowship program at IIT Bombay. Feel free to apply. We've just completed our first batch. Second batch is already onboarded. But first batch, we had 6 doctors join the program who work on medical devices. Many products are coming out of these sort of technologies, of these ideas that these doctors have. And hopefully, we'll see many, many more in the years to come. But it's a beautiful program supported by DBT, where we are going to train clinicians, non-clinicians in the art of biodesign, and to let them lead a product, from an idea all the way to a product manufacturing. So it will have several objectives, but most importantly, we'll train 50 medic fellows over 5 years, and then have at least 25 innovative medical products. The first year, we've already got 5, which means that if I continue doing 5 every year, I should be able to meet my target. We do a lot of helping for local community interns. More than 250, 300 interns are now trained in our lab. Every year, we take at least 20 to 30 interns and train them in the art of product manufacturing, end-to-end sort of designing. We also do a lot of students mentoring. I've just stopped taking PhD students, but we've already completed about 55 PhD graduates from my lab, more than 90, nearly touching 100 masters. But most importantly, we've published extensively in journals, and we've patented extensively. So if you look at my publications, if I have 300 publications, I've also got about 300 patent applications in. Of them, 100 have been granted, another 200 are underway, and many, many more will happen over the years, because we are continuing to innovate as we move along. Many products have been made, many startups have been set up. I already am a co-founder in 14 startups now. I'm the only person in the country who's now a co-founder in so many startups from an academic institute. But most importantly, each one of these startups has products which can reach the last mile. And that's where we want to create an impact. We want to create impact by creating high-value jobs, but most importantly, by benefiting patients. We get a lot of recognition. You see all the awards that I've got, nothing to do with me, it's always to do with what my students have done, what our lab has done, what IIT Bombay has done. And I keep saying that everywhere, that if you work for the country will recognize you, and they will make sure that you are brought out as an example for others to follow. And that's what we keep doing for the country. We have a lot of industry interactions with people in and around Mumbai, outside the Maharashtra area. But many people come to us today to get their work done because they know that we can deliver. With that, let me thank most importantly my mentors, because these are people without whom you don't stand where you are, and give this sort of lecture to motivate people, because I have been motivated by them. Professor Padmanabhan being, a huge towering figure, who's always motivated me, the ex-ISC director, but he's still active and he's still mentoring so many youngsters like me. Dr. Manju Sharma, who was the DBT secretary, we just recently lost her last year, but she was a towering figure who has helped me time and again. And Dr. Surup, who's always helping youngsters like me, but specifically she has mentored me and taught me how to work for India. Let me thank all my faculty members, collaborators, my students, and all the startups I have worked with, all of you that I have worked with, many interns who have passed through my lab, many people who've made an impact. And this is what my lab looked like at a time. We had more than 70 people working in the lab. Today, we are where we are because of all of you. So thank you very much. And thank you once again for inviting me. I hope I could bring out some of what we have done and could enthuse you to do more for our country. Thank you.
Camera.
Yeah. Thank you, Professor, for your invaluable presentation on utilization of nanotechnology for making a lot of sensors and devices which help in health sector. Thank you very much.
Thank you.
Professor Ashok Rashid also will.
Rohit, I have switched my office now. I have come here.
Thank you, sir.
So, fabulous talk. Of course, I have listened to it on a few occasions. So, but I think the students will be greatly benefited. And I just want to tell all the attendees online that he's a great role model, Professor Rohit Srivastava. Please, if somebody is interested in these areas, I think you should follow him and get in touch with him. And thank you very much, for sharing all these things. I'm sure that it is an inspiring talk. Many would be inspired to do
Thank you,
something.
sir.
Yeah. And also, he has informed even through message also. So, whatever the questions you have, please email it to office.kscst@iisc.ac.in, which will be addressed by the respective research speakers, research persons. So please send your queries through email, and who have joined through registration, and we have requested for a registration certificate, e-registration certificate, which will be sent through email. Email also has been given in the message. Anyway, I will ask, I will request my colleague, senior colleague, Mr. Venkatesh, to propose vote of thanks on behalf of KSCST. Over to Mr. Venkatesh.
Good evening to one and all. As we gather here to celebrate the Golden Jubilee of Karnataka State Council for Science and Technology, I'm very honored to propose vote of thanks to this occasion. First and foremost, I would like to extend my heartfelt thanks to our esteemed speakers for sharing their invaluable insights on the topic of application of technology and materials engineering. I thank Professor Navakant Bhatt, Dean, Division of Interdisciplinary Sciences, for his enlightening perspective on applications of nanotechnology, quantum technology, and other application initiatives. And I also thank Professor Ashok M. Raju, Secretary KSCST, and the Department of Materials Engineering for his talk on nanomaterials in research. Your support and encouragement, sir, in various projects and programs in initiatives at KSCST have been invaluable. Thank you very much, sir. I thank Professor Rohit Srivastava, Department of Biosciences and Bioengineering, IIT Bombay, for his technical talk on translational applications of nanotechnology and materials engineering. So we have given a lot of information for our young students to initiate startups ideas on patenting and so on. So thank you very much, sir. Your knowledge and passion for science and technology have inspired all of you, sir. Thank you very much, sir. So I thank Dr. U.T. Vijay, the Executive Secretary of KSCST, for his efforts in coordinating this panel and celebrating the Golden Jubilee through our webinar series. Thank you very much, sir. So I would also like to express my gratitude to the organizing committee at KSCST, including the project engineers, project associates, administrative officials, and accounts personnel for their dedication in planning this event. Thank you all. And finally, our target audience, faculty and students from various universities and engineering institutions all over the state. Thank you for your enthusiastic participation. As our Executive Secretary informed, we have posted our email. Any queries related to this present talk, you can just email us. We can pass on to the concerned experts and take the information and then send it to you. So your engagement is vital for the success of our initiative students and the overall development of the state. And once again, I thank to everyone involved in making this event a success. Thank you.
Thank you.
Thank you, Rohit, once again.
Thank you very much, sir. Thank you.
Certificate link is provided in the chat box. Please fill the certificate link.